Hello, my name is Catherine Brenneman, and I am here to do a report on bipolar, depressive disorders, and anxiety disorders. What is bipolar disorder? Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings. These include emotional highs, also known as mania or hypomania, and lows, also known as depression. Hypomania is less extreme than mania. What is bipolar disorder? Continued. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, you may feel very excited and happy, full of energy or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings from depression to mania may occur rarely or multiple times a year. Each bout usually lasts several days. Between episodes, some people have long periods of emotional stability. Others may frequently have mood swings from depression to mania or both depression and mania at the same time. Although bipolar disorder is a lifelong condition, people can manage their mood swings and other symptoms by following a treatment plan. In most cases, healthcare professionals use medicines and talk therapy, also known as psychotherapy, to treat bipolar disorder. Speaker notes. When it comes to manic episodes, there are periods of abnormally elevated, expansive, or irritable mood, along with increased energy, activity, and goal-directed behavior that may include decreased need for sleep, rapid speech and racing thoughts, feeling unusually important or powerful, engaging in risky or impulsive behaviors, in some cases psychosis, hallucinations, or delusions. With depressive episodes, that is usually filled with periods of low mood, characterized by sadness, hopelessness, and loss of interest or pleasure in activities which include fatigue and low energy, difficulty concentrating or making decisions, changes in appetite or sleep, thoughts of death or suicide. What is major depressive disorder? Major depressive disorder, also known as depression, is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel like life isn't worth living. More than just a bout of the blues, depression isn't a weakness, and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Speaker notes. Some key characteristics of major depressive disorder is persistent sadness, a prolonged feeling of sadness, emptiness, or hopelessness, loss of interest, pleasure, a significant reduction in interest or pleasure in activities that were once enjoyable. MDD can also manifest with changes in sleep, appetite, energy levels, concentration, self-esteem, and even thoughts of death or suicide. What is generalized anxiety disorder? Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events, even ordinary, routine issues. The worry is out of proportion to the actual circumstance, is difficult to control, and affects how you feel physically. It often occurs with other anxiety disorders or depression. Speaker notes. Common anxiety signs and symptoms are feeling nervous, restless or tense, having a sense of impending danger, panic or doom, having an increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems, having difficulty controlling worry, having the urge to avoid things that trigger anxiety. What is the diagnostic criteria for DSM-5 bipolar type 1 disorder? For a diagnosis of bipolar 1 disorder, it is necessary to meet the following criteria for a manic episode. The manic episode may have been preceded by and may be followed by hypomanic or major depressive episodes. Manic episode is a distinct period of abnormally and persistently elevated expansive or irritable mood and abnormally and persistently increased goal-directed activity or energy, lasting at least 1 week and present most of the day, nearly every day, or any duration of if hospitalization is necessary. During the period of mood disturbance and increased energy activity, The following symptoms are present to a significant degree and represent a noticeable change from usual behavior: inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual or pressure to keep talking, flight of ideas or unimportant or irrelevant external stimuli, as reported or observed, increase in goal-directed activity, excessive involvement in activities that have a high potential for painful consequences. The mood disturbance is sufficiently severe to cause marked impairment in social or occupational functioning or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features. What is the diagnostic criteria for the DSM-5 major depressive disorder? The DSM-5 criteria for major depressive disorder is depressed mood most of the day, nearly every day, may be subjective, feels sad, empty, or hopeless, can be irritable mood, loss of interest or pleasure, marked diminished interest and pleasure in all activities most of the day, nearly every day, may be subjective or observed by others, weight loss or gain, maybe failure to gain weight as expected, insomnia or hypersomnia nearly every day, psychomotor agitation or retardation nearly every day and observable by others, fatigue or loss of energy nearly every day, feeling worthless or excessive and inappropriate guilt nearly every day. Guilt may be delusional, not merely self-reproach or guilt about being sick. Decreased concentration nearly every day, may be indecisive, may be subjective or observed by others. Thoughts of death or suicide, recurrent thoughts of death, not just fear of dying, recurrent suicidal ideation without specific plan or suicide attempt or specific plan for suicide. What is the relationship between substance use disorders and both bipolar and depressive disorders? Substance use disorders can significantly impact both bipolar and depression. Individuals with these mental health conditions may turn to substances to cope with their symptoms, known as self-medication. Additionally, substance use can worsen mood episodes, complicate diagnosis, and hinder treatment. People with bipolar disorder may use substances like alcohol, cannabis, or stimulants to temporarily alleviate symptoms like depression or mania. Substance use can exacerbate mood swings, increase the frequency and severity of manic or depressive episodes, and make treatment more challenging. Substance use can overlap with bipolar, making it difficult to distinguish between substance-induced effects and actual mood episodes. When it comes to depression and substance use, individuals with depression may use alcohol or drugs to numb feelings of sadness, hopelessness, or despair. Substance abuse can trigger or worsen depressive symptoms, making it more likely for individuals to develop or experience a depressive episode. Substance use can hinder recovery from depression, making it harder to manage symptoms and maintain well-being. Both bipolar disorder and depression can increase the risk of substance use, and substance use can worsen or even trigger these mental health conditions. Speaker notes. Effective treatment for individuals with co-occurring mood disorders and substance use requires a comprehensive approach that addresses both conditions simultaneously, such as medication management, psychotherapy, and behavioral therapies. What is the relationship between substance use disorders and anxiety disorders? Substance use disorders and anxiety disorders frequently co-occur, with each potentially contributing to the other. Individuals with anxiety may turn to substances as a way to cope with symptoms, while substance use can worsen anxiety or even trigger anxiety disorders in some cases. This complex relationship highlights the importance of addressing both conditions simultaneously for effective treatment. Individuals with anxiety disorders may use substances like alcohol or drugs to temporarily alleviate their anxiety symptoms. This is known as self-medication. This can create a cycle where substance use provides temporary relief but ultimately exacerbates anxiety in the long run and can lead to substance use disorders. Anxiety can be a trigger for substance use. For example, someone with social anxiety might use alcohol to cope with social situations, or someone with generalized anxiety might use substances to manage persistent worry and nervousness. Speaker notes. The relationship between substance use disorders and anxiety disorders is complex and bidirectional. Understanding this relationship is crucial for effective diagnosis, treatment, and prevention efforts. What are some types of treatment interventions used for clients that have depressive disorder along with co-occurring substance use disorder and anxiety disorder? A recommended treatment intervention for a client with bipolar disorder is a combination of medication and psychotherapy. Specifically, mood stabilizers like lithium or certain anticonvulsants, and antipsychotics are crucial for managing manic and depressive episodes. Psychotherapy, including cognitive behavioral therapy, family-focused therapy, and interpersonal and social rhythm therapy, can help individuals understand their condition, manage symptoms, and improve social and occupational functioning. In conclusion, this is the conclusion of the presentation. I hope you learned a lot about bipolar disorder, major depressive disorder, and anxiety disorder. Thank you for listening, and I hope you have a great day.